Hey everybody, Dr. Derek Nielsen here. I am this guy. I know you can't see me, but I am this guy in the middle. I'm the owner of Kaizen Physical Therapy in Durham, North Carolina, where I specialize in helping people who have chronic pain, so pain that's been going on for a long time. They've tried physical therapy, chiropractic, acupuncture, massage, and just haven't got the solution they're looking for. And they want to avoid pain medications, injections, and surgery. So today, I am going to reveal to you how to get rid of nagging pain for good so that you can return to your active lifestyle, again, without medications, injections, and surgeries. So I'm going to try and be quick with this because I know we're all busy with life. So I want to go ahead and jump into it and try and be quick, but I'm going to talk about diagnosing, biggest mistake most people make, the biggest realization that you need to have, the two most important questions, and then we're going to talk about movement and how to get pain relief, and then ultimately how to fix the root cause of the problem. So let's jump right into it. So the biggest mistake that people make when it comes to diagnosing is they think that what they see on the x-ray or the MRI is the cause of their pain. So as you can see here, if we let's start in the neck. So people in there, this is a study of over 1,200 people. People in their 20s, 75% of them have a disc bulge in their neck. Almost 88% of the entire people in this study had a disc bulge in their neck. But here's the key: nobody in this study had any pain. If we look at the shoulder, 72% of people had a slap injury. So a slap injury is a labral tear in your shoulder, but yet no pain. So labral tear, no pain. Low back, 80% of people have disc degeneration in this study of over 3,100 people. 36% of people had a disc protrusion, so that is a herniated disc. It is the most severe classification of a herniated disc, but yet again, no pain. 69% of people had a labral tear in their hip, no pain. And 43 out of 44 people had a meniscus abnormality in their knee, but yet no pain. So the key is that just because you see something on an X-ray and MRI doesn't necessarily mean it's the cause of pain. And I'm going to dive into what you can do or a better way of thinking about it in just a moment with these two most important questions. So here's the biggest realization that people need to have: which person on the X-ray, which person has back pain? Is it the person on the right or is it the person on the left? Now, most people, from presenting this to multiple audiences, would say, here, the person on the right has back pain. But as you can see here, just because you see something on an image doesn't necessarily mean it's the cause of pain. So the correct answer is we don't know. We don't know because you can't see pain. So just because you can see an MRI and this spine looks a little bit out of alignment, if you will, looks a little bit different than this one, that doesn't mean this person has pain. You have no idea because you can't see it. So the realization that you need to have is just because you find something on an image, an X-ray or an MRI, doesn't mean it's necessarily the cause of pain. The two most important questions that we can ask is, when did the pain start? So did the pain start with a traumatic injury? Was there a fall? Was there a sports injury? Was there a car accident? When did the pain start? Or did it come on gradually? So the answer to that really identifies if the X-ray or the MRI are even really necessary. So I know from treating over the years that the majority of people have pain that came on gradually. And if pain came on gradually, then it's extremely likely that whatever is on the X-ray or the MRI was there before the pain ever started. But if conversely, if there was an injury, say a sports injury, then we know why the pain started. And what we find on the X-ray or MRI is a lot more likely to be the cause of the pain. But again, so I hope that makes sense. Is if the pain came on gradually, an X-ray or an MRI can show, say, degenerative disc disease, but it was probably there before the pain ever started. If the pain came on from an injury, then the x-ray or the MRI is way more meaningful, and what we find on there is way more likely to be the cause of the pain. And the person that has pain that comes on gradually is almost always in pain due to compensation, which I'm going to talk about in just a moment. So the other question is, what makes the pain better and what makes the pain worse? So what this question is getting at is it a movement problem? Is it a muscular problem? So if pain gets better with certain movements, say pain, let's go with worse. If pain gets worse with certain movements, let's say back pain or sciatica is worse with standing and walking, but then it's better with sitting and lying down. That says that we have a movement problem. So pain is worse with standing and walking is movement. Pain's better with sitting and lying down. We have a movement problem, and we need to fix movement. So that pertains to everywhere in the body. So these two questions can really identify, hey, when did the pain start? If it came on gradually, then it's likely that there's compensation that is the ultimate problem, and we need to fix the compensation. And if pain gets better with some movements and is worse with other movements, then that even further identifies that there is a compensation problem and we need to fix movement. So movement, let's jump into that. Here is how our body is meant to work. Is we have joints that are mobile, we have joints that are stable. So you can see in our hand they're more stable, meaning that they're stronger. They just don't move as much. The wrist is more mobile, elbow is more stable, shoulder is more mobile, scapular girdle is more stable. You got the thoracic spine, so mid-back is mobile, low back is stable. And that's how our body is supposed to work. Every other joint is mobile, every other joint is stable. When one joint switches, so let's say that this hip is supposed to be mobile, all of a sudden it's not moving like it should, somewhere else has to compensate, and that's when pain can occur. So if this low back has to all of a sudden compensate because that hip isn't moving very well, the pain could come here. But the problem isn't necessarily the low back. The root cause of the problem can be that hip. And this type of scenario happens all over the body, which is why in just a moment I'll talk about it's not just about pain relief, it's about finding the root cause of the problem to make sure the pain doesn't come back. And so if we jump into pain relief, how do we achieve pain relief? Well, the best things that I find is massage. I use a lot of myofascial release. Dry needling works really well, and then some simple light stretches. Those are the four main components that I find that work the best for pain relief. But again, pain relief isn't the same as a long-term solution. So how do we fix the root cause of the problem? Well, we start with mobility. Mobility goes along with fixing, finding a pain relief. But if we're going to find the root cause, fix the root cause of the problem, we want to dive in and fix mobility first. So how does that look? So we fix mobility, like I say. We want to get mobility back to being full and symmetrical. So for the most part. So your left hip should move pretty close to you as well as your right hip. Your spine should rotate as well left as it does right. Your shoulders should move very similarly left and right. Your neck should rotate left and right very symmetrically. So I want to dive into kind of more about what we're looking at here. So if I bend down and touch your toes, this requires spine flexion and hip flexion. It requires both of them. So as you move throughout the day, it isn't just demanding one area of the body to work. It's demanding multiple parts of your body to work. So if you go down and you touch your toes and you have low back discomfort, that doesn't necessarily mean that the low back is the problem, because this movement also requires hip flexion. So it could actually be a hip problem, which I find is the far majority of the cause of low back pain. But the low back could be compensating for a hip problem, and you have low back pain. Okay, so we go down and touch our toes. There's one of the core movements that we need to look at. Is it full? Can you touch your toes? And is there no pain? If that is the case, we move on. And we bend back. And we have spine extension combined with hip extension. So again, if a lot of people here, if they have low back pain, or if they're suffering from low back pain, this will cause a little bit of low back discomfort, but it doesn't necessarily mean it's a low back problem. It could be a hip problem. Okay, so there's number 2. Number 3 is rotation. So rotation takes spine rotation. It takes the left hip rotating, left ankle rotating, right ankle, and right hip. So if you have discomfort anywhere, could be the hip, could be the low back, could even be your neck, we have to find out where the problem actually is, because it takes all of these combined to perform the movement. And then rotation right. And same thing. So we're not just looking at, hey, is it painful? We're also looking at, hey, is it tight? Is there any tightness with it? And combined with, do you have the full amount of mobility? So you should be able, when you rotate, you should be able to see very close to the opposite shoulder. And if I come back here, see, you can see my opposite shoulder here, and the camera angle is a little different here, but very closely you can see my opposite shoulder there. So there's full. And then next we have a squat. Oh, let me back this up. So a squat takes, as you can see, it takes hip flexion, ankle flexion, spine extension. So if there's any discomfort, any tightness with that, it could be caused from any of those areas. Okay, and then lastly is balance. And that takes trunk stability, hip stability, and ankle stability. And we want to be able to lift one leg and hold for about 10 seconds on each side with our hands quietly placed to our sides. So those are the core movements that I look at to be able to test mobility, to be able to test stability, and figure out what could possibly be the underlying root cause of the problem. So we look at flexion, extension, and rotation. And that's really, if we go back here, that's what I'm looking at, is I'm looking at flexion. So this is a flexion movement. Flexion, flexion. Then we look at extension, extension, extension. Then we look at rotation. Rotation, 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 rotation. Same thing on the right. We're looking at pure rotation. Is there a problem with any of those? Then a squat. You've got flexion, flexion, extension. Then we look at balance, pure stability. So these are the core movements, and we get it all. We get flexion, we get extension, we get rotation, and we get stabilization. So if there's a problem with any one of those, we dive into and find out where the root cause of the problem is coming from. Okay, so that's mobility. And then what is stability? So once we fix mobility first. Then once we fix mobility where we need it, we fix stability. So instability equals full mobility, but for some reason, but you can't access it. And I'm going to dive into that in just a minute. I'll show you exactly what I mean by that. But let's go into this funny looking picture. So the neurodevelopment model of children and how we progress as kids is really what I follow when it comes to stability exercise. So toddlers and kids, they don't have a problem with mobility. So they've got all the mobility that they need. Their neck, their shoulder, their spine, their hips, their knees. They've got all of it. They've got plenty of mobility. What they're lacking is stability. So that's the reason why a baby can't go straight from lying on their back to standing. because they have instability. They have to gain stability as they get older. So they start on their back, then they go to their stomach, then they're able to roll, then they go to their hands and knees, then they're finally crawling, sitting, kneeling, squatting, standing up, and then finally walking. This is the progression of stability. Now, I don't follow in sequence with all of these, but it really comes down to these 4 that I have circled. We start on our back. Once we get mobility where we need it, the stability exercises, we start on our back. Is there a problem in that position? We fix it there first. Then we go hands and knees. Is there a problem in that position? We fix it there second. Then you go on your knees. Is there a problem there? We fix it third. And then finally, fourth is standing and gait. And typically, by the time we get here, we really don't even need to do anything because we fixed it here, here, and here. And this one just magically gets better along the way. But these are the 4 progressions that I follow as far as fixing stability. So let's dive into just a little bit more of a video that I made. So here's some examples of some stability so you can gain a little further understanding of what that is.
So I want to talk a little bit about what stability is. So as you saw in the slide before, I had showed you the progressions of neurodevelopment, or how we progress as babies. And we don't have, as kids or as babies, we don't have a problem with mobility. We're limited by our instability or lack of stability. So the thing we want to do is once we get mobility where we need it, we want to start working on stability. And that first phase is lying on the back. So a lot of times what I find here, there's a couple different movements, but stability really is you have the mobility, but yet for some reason your body will not tap into that mobility. Not for some reason, because of an instability, your body will not tap into your maximum amount of mobility. So let me show you. What we can do is say, all right, go ahead and lift your leg up. Go as high as you can. And then I can say, okay, let me do it for you. So imagine that I'm someone else, or someone else is pressing my leg up. Can they get me quite a bit higher than I'm able to get myself? So for example, let's say I can get there, then somebody presses my leg up, and not hard. I'm not saying you try and jam it up. It's just light. But let's say they can get my leg a lot higher. That's a form of, or a sign that there is some instability with that movement. So how do we retrain it? There's quite a few different ways. Everybody is different. So one of my go-to ones is with a weight in the hand, opposite leg, and go ahead and lift. And that, what the weight is doing is it's forcing your trunk to stabilize. And by stabilizing here, it allows the hamstrings and leg to lift up. If that doesn't work, there is a band, pull out, lift up. If that doesn't work, we can pull down with the band. If that doesn't work, we can do what's called a leg lowering in the doorway. So the point I want to make is everybody's different. Everybody's different, and that's why I can never tell somebody exactly what to do for back pain or exactly what to do for sciatica or shoulder pain, because everybody is different. But once we get mobility where we need it, then we start to figure out, okay, what movements are lacking stability. So you just saw, this is called hip flexion. There's also rotation. So that's external rotation. You've got internal rotation. You've also got hip extension. So the prime movements, flexion, extension, rotation. And we figure out where the problem is once we clean up mobility. Where is the instability? And that's what we fix. And we do it in the progression that I had already showed you. First on your back, then on your hands and knees, then you're going to sit tall, and then finally stand. So there's 4 progressions to that in order to regain that stability back. And that's really what gets people the long-term solution that makes sure that the pain, we give us our best possible chance that the pain doesn't come back.
And there you have it. So it's really fixing pain first with simple massage techniques, myofascial release, dry needling, simple stretches, and then fixing the root problem by fixing mobility where we need it. It's going to be either flexion, extension, or rotation, and then finding out where the instability is and fixing it in this model to make sure that we give us our best possible chance of the pain not coming back. Well, I hope you got some value from that short lecture. I tried to go over it quick. Now, if you're looking for help, I would love to get you into the clinic and find out if I could be a long-term solution for you. Right around this video, there's going to be a little button that you can click for a $49 visit. What it'll allow you to do is come into the clinic with me for about an hour. It'll allow me to learn more about you, learn your past medical history, ask you the questions: what makes the pain better, what makes it worse, did the pain come on gradually, was there an injury, what have you tried that hasn't helped. Learn everything about you so I can start identifying where the root cause of the problem is. I'll also give you some things that you can start doing immediately for some pain relief. And then more than anything, we will find out what a long-term solution looks like for you. If you're interested in that, go ahead and click that button, fill out the simple form, and then we'll schedule a phone call and I'll talk with you before you come into the clinic, and then we will get you scheduled to come in for that visit. All right, well, thanks so much for listening, and I hope you have a great day.